This is the Dollemore Daily, and I'm Jesse Dollemore. Yesterday, I talked about Karl Rove, the former Deputy White House Chief of Staff to George W. Bush, and the troubling remarks he made on Fox News. Well, this past weekend, some equally troubling things were said about or by a Trump administration official, namely Alex Azar, who is the Health and Human Services Secretary. Now, the reason I'm going to talk about it a couple days late is because it didn't get the press that I think it should. And in the moment that we are in history, we need leaders who lead, not leaders who finger point and pass the buck and blame others in the face of their very challenging jobs. Now, I'm going to do something a little bit different than I normally do. Normally, I just play the clip and then I talk about it. But so many things were said in rapid-fire succession of stupidity that I want to start and stop the clip. I'm going to start it, stop, and talk about it as we go. So this is Alex Azar on with Jake Tapper from CNN, talking about the government's response and the particular death toll that we are facing right now in the United States, which is over 90,000 dead Americans who otherwise wouldn't have been dead if it hadn't been for Donald Trump's negligent response to this particular health crisis that we're facing right now. Let's watch this. Alex Azar and Jake Tapper.
This as a country?
Jake, you can't celebrate a single death. Every death is a tragedy, but the results could have been vastly, vastly worse. It's also important to remember, Jake, as we
it's
face
worse for us than it is for anyone else.
No, that's actually not factually correct. When you look at mortality rates, that's simply not correct as a percent of diagnosed cases, Jake. That every death is
just
tragic.
At the number of dead bodies.
Every death is tragic, but we have maintained our healthcare burden within the capacity of our system to actually deal with it.
Let's just start there. What does it matter the percentages? If 90,000 Americans are dead and more citizens in our country have died than in any other confirmed deaths in any other country, if you lost a loved one, if you lost your mother or your grandmother or your father or your grandfather, a wife, a child, does it give you any solace whatsoever that, oh, well, our percentages are not quite as much? No, you lost your loved one. Trying to make this some kind of a statistical anomaly or talk about this from the standpoint strictly of the numbers and not about the real toll of human loss of life is callous, to say the least. This is the Secretary of Health and Human Services. And we're going to get into that, what exactly that particular department of our government does. But this is a disgusting charlatan who is trying to cover up for the lack of response, the failure of his boss, licking the boots of Donald Trump rather than doing the right thing and sounding the alarm that more could have been done, that not enough right now is being done. It's not even like they can look back and say, oh, yeah, we didn't do enough in the beginning, but let's correct course. They're not doing that. They're doubling down on their incompetence day after day after day, with Donald Trump at the helm and captains like Alex Azar covering for him. Let's go back to the clip.
Every death is tragic, but we have maintained our healthcare burden within the capacity of our system to actually deal with it. Unfortunately, the American population is a very diverse and it is a population with significant unhealthy comorbidities that do make many individuals in our communities, in particular African American, minority communities, particularly at risk here because of significant underlying disease health disparities and disease comorbidities. And that is an unfortunate legacy in our healthcare system that we certainly do need to address.
Shameful. shameful that these words came out of the Secretary of Health and Human Services' mouth. Unfortunately, the American population is a very diverse, what am I getting ready to say? Oh my God, why am I saying the quiet part out loud? The American population is a very diverse population. To finish his sentence. And then he scrambles to come up with talking about comorbidities. We'll talk about both. First, the egregious statement that unfortunately the American population is a diverse one. Of course, we know that that is what the central mission of Donald Trump's administration is, whether it be immigration, legal and undocumented immigration, or in our healthcare. That Donald Trump wants to target and pour hatred and vitriol upon our diverse population. He said it with his own mouth that unfortunately America is a diverse population. Not unfortunately. Our diversity is our strength because of, from the diverse viewpoints, the diverse life experiences, we enrichen this country. We strengthen our laws and our policies based on that diverse outlook. But apparently, to Alex Azar and Donald Trump, it is an unfortunate thing that America is diverse. Look, I know there's probably people out there where they say, well, no, he just stumbled over his words. Don't buy that. Do not buy that this was some slip of the tongue. It's in there. Primarily and chiefly, it is in there to come out. And as far as comorbidities are concerned, it might even be more troubling. First of all, a comorbidity is the simultaneous presence of, what's the exact definition? The simultaneous presence of two chronic diseases or conditions in a patient. So like if you have heart disease and diabetes, that's a comorbidity. If you have arthritis and something else that's very serious, comorbidity. So he's blaming, and he's talking specifically about the African American population, about the comorbidities that exist within the black population of America. He went straight from, it's unfortunate that America's population is so diverse, pivoted straight as a way to get out of his stupid thing that he said, to pointing the finger at black Americans. This is the Trump administration, everybody. No one from the administration came out and challenged anything he said, because they agree with it. They put Stephen Miller as the chief policy advisor on matters such as this. The virulent, racist, white supremacist. Let's let the clip continue.
And that is an unfortunate legacy in our healthcare system that we certainly do need to address. But no, the response here in the United States has been historic to keep this within our healthcare capacity. Even in New York City, to keep this within capacity is genuinely a historic result.
I want to give you an opportunity to clear it up, because it sounded like you were saying that the reason that there are so many dead Americans is because we're unhealthier than the rest of the world. And I know that's not what you meant.
No, I think that we have significant.
Yeah. Let's clear that up though, Jake. It's not that he's not talking about we're unhealthier than the rest of the world. He's specifically talking about, black people. They're unhealthier and they're dragging our numbers down. They're the reason that we have over 90,000 deaths right now. It's not because of a lack of response of the administration and Donald Trump and Mike Pence. It's not because of that. It's because of the black folks. That is what he's saying. And look, I get it. In the heat of the moment, you might not catch exactly every single lie and outrageous statement that's being told as a journalist. CNN and their anchors have some problems. I think Jake Tapper overall is a stand-up guy. So I'm not going to fault him too much here, but this is not what Alex Azar is saying, that generally as Americans we're unhealthy. That's not it. Let's let it continue.
I want to give you an opportunity to clear it up because it sounded like you were saying that the reason that there are so many dead Americans is because we're unhealthier than the rest of the world, and I know that's not what you meant.
No, I think that we have a significantly disproportionate burden of comorbidities in the United States: obesity, hypertension, diabetes. These are demonstrated facts that do make us at risk for any type of disease burden.
Sure, of course, but that doesn't mean it's the fault of the American people that our government failed to take adequate steps in February.
Oh no, Jake, please don't distort. No, this is not about fault. It's about simple epidemiology and stating that if we have hypertension, if we have diabetes, we present with greater risk of severe complications from this coronavirus. That's all I was saying, and you know that. This is not, one doesn't blame an individual for their health conditions. That would be absurd. It's simply a statement that that we do have greater risk profiles here in the United States.
Oh, Jake, please, don't put words in my mouth. That's not what I'm saying, Jake. What I'm actually saying is that it's unfortunate that the American population is diverse. That's all I'm saying, Jake. Don't put words in my mouth, Jake. What happened? The Health and Human Services Mission, as stated on its website, it is the mission of the United States Department of Health and Human Services to enhance and protect the health and well-being of all Americans. We fulfill that mission by providing for effective health and human services and fostering advances in medicine, public health, and social services. They are enhancing and protecting the health and well-being of all Americans, while maligning a significant portion of them. They're not standing up to fulfill their mission by providing effective health and human services and fostering advances in medical and public health and social services, while Donald Trump is trying to slash and burn federal budgets of this exact agency. This is disgusting. This is virulent. This is unacceptable. And we have a moment, we are faced with a choice right now in November to rid ourselves of this kind of insanity. And I hope that you'll join me in voting against Donald Trump, to remove Donald Trump and set ourselves back on a course toward the protection of people who need protecting. Finally, once again, have an administration that doesn't punch down constantly, doesn't try to remove SNAP benefits, food stamp benefits, from hundreds of thousands of children in the midst of a pandemic, that doesn't put racists on CNN to proclaim that it is unfortunate that America is so diverse. This is our moment. Anyway, I'd love to know what you think. 714-576-4054. Email me daily at dollemore.com. If you have been on the fence, if you are interested in helping support my work here, independent media, you can do so by clicking the little join button under the video. Become a channel member for fewer than $2 a month. You can support my work right here on YouTube. And listen, if I'm not exactly your flavor, if you're here and you're not subbed, check me out. But if you get more value from someone else, a Benjamin Dixon or a David Packman or whomever, I don't know everybody who has the channel memberships on their channel, but if you get more value from someone else, please support independent media. It is important because of things exactly like this. See you next time. I appreciate you guys very much. Stay safe, be genuine, take care of one another.